laugh, you frown, you concentrate. And over time, the muscles between the brow that cause these expressions can leave a lasting mark on the way you look and how you look to others.
My frown lines made me appear stern or disapproving.
My daughter said that I was looking older.
People were saying that I looked angry or too serious.
The good news is these expressions don't have to leave lasting impressions. In today's world, you have many options to choose from, but there's only one Botox cosmetic. Hi, I'm Lisa Masters, and I'm here to tell you about Botox Cosmetic, a simple, non-surgical, physician-administered treatment. It can temporarily smooth moderate to severe frown lines between the brows in people ages 18 to 65. Botox Cosmetic is prescription only, and it's the only treatment of its kind approved by the Food and Drug Administration. Since the procedure is non-surgical and administered in about 10 to 20 minutes, there's no recuperation time. So you can go right back to your regular activities the same day. A visible improvement in the reduction of frown lines between your brows can be seen within days, and the results can last up to 4 months. We've created this video to help you understand more about Botox Cosmetic, what it is, how it works, and how it can visibly improve the appearance of frown lines between the brows. After viewing this program, talk with your doctor about Botox Cosmetic to see if it's right for you. Only a licensed, trained healthcare professional can administer Botox Cosmetic, although dermatologists and plastic surgeons are generally more experienced. Allergan Incorporated, the manufacturer of Botox Cosmetic, is the only source for healthcare professionals to purchase the product, and each label has the Allergan hologram. Now, let's cover the questions that are on everyone's mind. Botox. Botulinum toxin type A has been used therapeutically for 15 years to treat certain medical disorders. It's approved in more than 75 countries. Botox for therapeutic use remains one of the most widely researched medicines in the world. The same product, with dosing specific to glabellar lines, was approved in 2002 as Botox Cosmetic. Over time, movement of brow muscles causes the skin to crease. As skin becomes less elastic, repeated frowning creates lines and wrinkles between the brows. The clinical term for this is glabellar lines. Botox Cosmetic is a purified protein produced by the Clostridium botulinum bacterium that smooths the muscles by blocking nerve impulses. With a few tiny injections, Botox Cosmetic blocks the release of acetylcholine, the chemical that causes muscles to contract. With less movement, the skin surface gradually smooths out, and the lines begin to fade. You'll still be able to frown, smile, or look surprised, but without the creases and wrinkles between your brows. Botox Cosmetic is truly one of a kind because it's the only product with this mechanism. Some products mask the wrinkle by adding volume around the muscle with intradermal injections. Botox Cosmetic is intramuscular, blocking the chemicals that cause facial muscles to contract, thereby relaxing them. While there are many options available for these fillers, Botox Cosmetic is the only product of its kind that affects the muscles that cause wrinkles between your brows. The result? A visible improvement in your appearance that others will notice too.
I love the results.
Results have been terrific.
I think the lines are much less noticeable.
This simple, non-surgical procedure consists of a few tiny injections and can be performed right in your doctor's office. No anesthetic is required. The first thing your doctor will determine are the places that need to be treated. prior to being injected, these areas may be numbed with a cold pack or anesthetic. These are the sites where you can expect to be injected with Botox Cosmetic. Using a very fine needle, a tiny injection will be made into each site. You can even receive Botox Cosmetic treatment on your lunch break, and within days, you'll see a noticeable improvement in the appearance of the vertical lines between your brows. And there's no recovery time. Now, let's hear from some patients who've experienced Botox Cosmetic treatment.
The procedure was very easy. It was just a few pinpricks, and in a couple of minutes it was over.
It was something that I could do and just be in and out of the doctor's office in no time at all.
Just took about 10-15 minutes, and then I was off to dinner.
Patients with certain neurological disorders, such as ALS, myasthenia gravis, or Lambert-Eaton syndrome, may be at increased risk of serious side effects. Serious allergic reactions have been rarely reported. If you think you're having an allergic reaction, such as difficulty swallowing, speaking, breathing, or other unusual symptoms, call your doctor immediately. The most common side effects following injection include headache, respiratory infection, flu syndrome, temporary eyelid droop, and nausea. Full prescribing information has been provided to your doctor. You can expect to see noticeable improvements in a matter of days. And you may continue to improve during the first week after treatment. Optimal results should be visible within 30 days.
I saw an improvement in my frown lines within a few days, and it just kept getting better and better over the next couple of weeks.
When I look in the mirror, I like what I see now.
With proper dosing of 20 units in the glabella region, the positive effects of treatment can last up to 4 months. Ordinarily, you would only need to repeat the treatments 3 or 4 times a year. And treatment with Botox Cosmetic can be repeated as long as you continue to respond.
I schedule treatments every 3 to 4 months. So I'm pretty diligent about it because I feel like it makes a difference.
I wouldn't think twice about doing it again. It was that simple.
My friends noticed a difference, but they couldn't figure out why. And that's the kind of look that I wanted. Something was very subtle.
According to a recent survey of 204 dermatologists and plastic surgeons, Botox Cosmetic has the highest perceived patient satisfaction rating of all physician-administered treatments in 2003 and 2004. And for 3 years now, Botox Cosmetic has been the most popular physician-administered cosmetic procedure in the United States, surgical and non-surgical combined, according to the American Society for Aesthetic Plastic Surgery. Just last year, it was estimated that almost 3 million people were treated with Botox Cosmetic. If you are considering becoming one of these Botox Cosmetic patients, talk with your doctor about treatment and whether it's right for you. Because you have a choice. You can live with frown lines between the brows, or you can live without them.
I'm satisfied with the results. I'd do it again.
They were really positive comments and made me feel good.
If somebody asked me if they should do it, I would say definitely go for it. It's very simple. It's a very quick procedure.
Botox Cosmetic is important to me, and I'm going to continue to have the treatments.
Today, I got back into my favorite jeans.
I had a really good hair day.
I found some great shoes on sale.
I asked my doctor about Botox Cosmetic.
Are you thinking about it?
Want to know more? Talk to your doctor or find one at BotoxCosmetic.com. The one, the only Botox Cosmetic.
Are you ready?